Hemorrhoids, a common yet rarely discussed medical condition, affects millions worldwide. These are swollen veins in the lowest part of your rectum and anus, similar to varicose veins. When the walls of these vessels are stretched, they become irritated. This condition is so prevalent that roughly half of adults have experienced the symptoms of hemorrhoids by the age of 50. Understanding hemorrhoids is not only a matter of personal health, but also a societal concern. It's crucial to break the stigma and silence surrounding this condition, as it can lead to unnecessary discomfort and can even affect one's quality of life. Furthermore, knowledge about hemorrhoids contributes to overall health awareness, promoting early detection and treatment of this and other related conditions. In the grand scheme of things, hemorrhoids are a small part of a larger health picture, but they're a part that we can't afford to ignore. Now that you understand what hemorrhoids are, let's delve into the causes. Many factors contribute to the development of hemorrhoids, and understanding these can help in prevention and management. Hemorrhoids, also known as piles, are essentially swollen veins in the lower part of the rectum and the anus, similar to varicose veins. The development of hemorrhoids is often linked to an increased pressure in this area, which causes the veins to swell and become inflamed. One common cause of this increased pressure is constipation. When stool is hard and dry, it requires more effort to pass, which can lead to straining during bowel movements. This straining increases the pressure in the veins in the lower rectum, which can lead to hemorrhoids. On the other hand, lifestyle factors also play a significant role. A diet low in fiber can lead to constipation and straining, making it a common culprit. Fiber-rich foods help to soften the stool, making it easier to pass and reducing the need to strain. So, a diet low in fiber can be a contributing factor to the development of hemorrhoids. In addition, lack of physical activity or prolonged periods of sitting can also lead to an increased pressure in the lower rectum. Regular exercise helps to stimulate bowel movements and reduce the pressure in the veins of the rectum. So, a sedentary lifestyle can be a significant risk factor in the development of hemorrhoids. It's important to note that while these are common causes, anyone can develop hemorrhoids. Factors such as aging, genetics, and even pregnancy, due to the increased pressure on the rectum it causes, can all lead to the development of hemorrhoids. In essence, anything that increases pressure on the lower rectum can potentially lead to hemorrhoids. Understanding these causes can help us take steps to prevent the condition or manage the symptoms if they do occur. Knowing the causes of hemorrhoids is crucial, but recognizing the symptoms is equally important. Hemorrhoids can be internal or external, and the symptoms may vary accordingly. In the intricate world of our bodies, hemorrhoids are typically hidden from view. They exist as swollen veins in the lowest part of our rectum and anus. Sometimes the walls of these blood vessels stretch so thin that the veins bulge and get irritated, especially during bowel movements. These are what we call hemorrhoids, and they can be internal or external. When we talk about internal hemorrhoids, they're found inside the rectum. These can be harder to identify as they're not visible, but they do present symptoms. You may experience a sense of discomfort or fullness in the rectum, often described as a feeling of needing to pass stool even after you've just had a bowel movement. In some cases, internal hemorrhoids can also cause bleeding during bowel movements. This is generally painless, and you might only notice bright red blood on toilet paper or in the toilet bowl. Then we have external hemorrhoids, which are located under the skin around the anus. These can be seen or felt, often presenting as a hard, sensitive lump. They can cause discomfort and itching, as well as bleeding during bowel movements. You may also notice swelling or a lump around your anus, which can be sensitive or painful, particularly during or after bowel movements. It's important to remember that while these symptoms can be disconcerting, they are also quite common. Hemorrhoids are a condition many people experience, often due to factors like straining during bowel movements, sitting for long periods, or conditions like pregnancy or obesity. The good news is these symptoms are often manageable and treatable. Simple lifestyle changes can make a big difference, and there are a plethora of treatment options available, from over-the-counter creams to medical procedures. Though these symptoms can be uncomfortable, there are a variety of treatment options available. Remember, if you're experiencing any of these symptoms, it's always best to consult with a healthcare professional to get a proper diagnosis and treatment plan. From home remedies to medical procedures, there are several ways to treat hemorrhoids. Let's start with the simplest methods, the ones you can do from the comfort of your own home. Perhaps the most common and accessible treatment for hemorrhoids is a warm bath. Submerging the affected area in warm water can help soothe the inflammation and reduce discomfort. Over-the-counter creams and ointments are another option for home treatment. These medicines often contain hydrocortisone, a steroid that helps reduce inflammation. They can be applied directly to the hemorrhoids, providing relief from pain and itching. Dietary changes can also play a significant role in managing hemorrhoids. Consuming a diet rich in fiber can help soften stools, making them easier to pass and reducing the strain on the hemorrhoidal veins. Hydration is equally crucial. Drinking plenty of water can aid digestion and prevent constipation, one of the leading causes of hemorrhoids. Now let's move on to the more advanced treatments. If home remedies and lifestyle changes aren't enough, it might be time to consider medical procedures. One such procedure is rubber band ligation. This involves placing a small rubber band around the base of the hemorrhoid, cutting off its blood supply and causing it to shrink and fall off. It's a relatively straightforward procedure that can be done in a doctor's office. For more severe or persistent hemorrhoids, surgical intervention may be necessary. Hemorrhoidectomy, the surgical removal of hemorrhoids, is considered the most effective long-term solution. However, as with any surgery, it comes with its own risks and recovery period. Another surgical option is stapled hemorrhoidopexy. This procedure uses a circular stapling device to lift and reposition the hemorrhoids, reducing their size and alleviating symptoms. It's generally less painful than a hemorrhoidectomy and has a quicker recovery time. It's important to note that while these treatments can help manage the symptoms of hemorrhoids, they may not prevent them from recurring. Determining the right treatment for you depends on several factors, including the severity of your symptoms, your overall health, and your personal preference. Remember, you should always consult with a healthcare professional before starting any new treatment. They can provide you with a thorough evaluation and guide you towards the most suitable treatment option for your situation. Finally, it's worth mentioning that living with hemorrhoids often involves making certain lifestyle adjustments. These might include adopting a high-fiber diet, staying hydrated, exercising regularly, and avoiding prolonged periods of sitting. Regardless of the treatment method, living with hemorrhoids requires certain lifestyle adjustments. These changes can not only help manage your symptoms, but also reduce the likelihood of hemorrhoids recurring in the future. So, while treating hemorrhoids might seem daunting at first, remember that there are plenty of options available, and with the right approach, you can effectively manage this condition. Living with hemorrhoids can be challenging, but certain lifestyle changes can make a big difference. You may feel a bit overwhelmed initially, but remember, you're not alone. Many people deal with this condition, and there are several strategies to manage it effectively. One of the key areas where you can make a significant impact is your diet. Consuming a diet rich in fiber can help soften stools and reduce the pressure on your hemorrhoids. Think whole grains, fruits, vegetables, and legumes. And don't forget to stay hydrated. Drinking plenty of fluids, especially water, can help prevent constipation, a common trigger for hemorrhoids. Physical activity is another crucial aspect. Regular exercise, particularly activities that don't exert too much pressure on the anal area, can promote bowel movements and reduce the risk of constipation. Simple activities like walking, swimming, or yoga can be beneficial. As mundane as it sounds, the way you sit matters too. Prolonged sitting, especially on the toilet, can increase pressure on the veins in the anus. Try to avoid sitting for extended periods, and consider using a donut-shaped pillow for comfort, if you must sit for a long time. Now, while these lifestyle adjustments can help manage hemorrhoids, they are not a substitute for professional medical advice. Regular checkups and open communication with your healthcare provider are essential. They can monitor your condition, offer advice tailored to your situation, and provide treatment options if needed. Living with hemorrhoids also means being patient with yourself. It's a condition that doesn't necessarily resolve quickly, but with consistent efforts and the right approach, you can significantly improve your quality of life. Remember, it's okay to seek help and talk about your condition. There's no need to feel embarrassed or alone. There are plenty of resources and support available, including healthcare professionals, support groups, and even online communities. While hemorrhoids can be uncomfortable and even painful, with the right knowledge and adjustments, they can be effectively managed. Today, we have explored the ins and outs of hemorrhoids, a common yet often misunderstood condition. We've delved into the heart of what hemorrhoids really are: swollen veins in the lowest part of your rectum and anus, sometimes likened to varicose veins. We've also examined the various causes that can lead to this condition, from straining during bowel movements to increased pressure during pregnancy. We've looked at the symptoms, which can range from discomfort and itching to more severe signs like bleeding. Our journey continued through the different treatment options, both medical and home remedies, that can provide relief and promote healing. And finally, we've discussed how to live with hemorrhoids, focusing on lifestyle adjustments, including dietary changes and exercise, to manage this condition effectively. Remember, knowledge is power when it comes to managing health conditions like hemorrhoids. Stay informed, stay healthy.